that then I miss the reflexes. Stop it. Stay away from my staff. Please. Okay, ready? Okay. Are you timing? I'm Cindy. I'm going to be your nurse practitioner student today. Today I'm going to be doing a head to toe assessment on you. If anything hurts, please let me know. I'll be describing what I'm doing and I'll be describing to the instructors my findings. So first of all, I'm going to be looking over at your general overall well-being and health. You're appropriately dressed and you look like you're in no apparent distress. So throughout this exam, I'm going to be examining your skin for color, trigger, moisture, scars, hair distribution, any lesions. All right, so the first thing I'm going to do is have you put your hands out like this. I'm just going to be looking at your hands, looking for any abnormalities, any pain there. Looking at cap refill, which is brisk at 3+. And I have you do this for me. And I'm looking for any clubbing. Good, so negative for clubbing. Next, I am going to go on to your pulses, feeling here. They are, radial pulses are 2+ out of 4. They are symmetrical, regular, in rhythm, and regular, symmetrical. Okay. Next, amplitude is 2+. Okay, next we're going to go on to your wrists. So I'm going to be feeling your wrists for any pain there. Good. Going to go up your arm all the way up. No bony abnormalities, no redness, no tenders. Stopping at the olecranon, feeling for any pain there. Going on to the glenohumeral joint. All right, from your wrist, going all the way up to your olecranon. Again, feeling, going up to your glenohumeral joint. Any pain there? Nope. All right, so next we're going to do some grips. Go ahead and resist against me. Good. So grip 5 out of 5. Now we're going to do some range of motion exercises. So just follow after me. I'm going to have you put your hands out like this. Great. And then I'm going to have you bend them up. So flexion, extension, and then I'm going to have you supinate and pronate. Okay, good. So good positive range of motion of the lower arms. Next, we're going to go on to shoulder range of motion. Here, I'm going to go ahead and have you stick your arms out like this. So, and then I'm going to have you pronate. No. Oh, God. Now I'm going to have you abduct. I'm going to have you supinate, pronate. I'm kind of losing track of what I need to do here. Okay, then I'm going to have you do internal rotation of the shoulders, external rotation following me. There I'd be looking to see how far up the back that was going. Good. So full range of motion of the shoulders. Okay, you can go ahead and put your arms down. Now we're looking at your hair distribution. I'm just looking for the pattern. I see no infestations. Hair distribution is normal, no rashes. Next, we're going on to the eyes. Here I'm looking for
tricep strength, bicep strength.
Okay, so next we're going to do some strengths. Okay, so next I'm going to have you stick your arms out like this, resist against me. Good. So 5 out of 5 bicep, resist against me, 5 out of 5 tricep, arms out like this. Good. Press down, 5 out of 5 on the deltoid. All right, so now we're going to go back to your eyes. So your eyes, I'm looking for any what's that? Exophthalmos. I'm looking for any swelling, and I'm looking for any lid lag, none of which that I see. So do you wear glasses or contact lenses? No. All right, so the next thing I'm going to do, I'm going to go ahead and do the fundoscopic exam. With this, Kai, I'm just going to be touching this on your face. Here, I'm going to be looking for the red reflex, making sure my stuff is good. Here, going in, good, positive red reflex. Going in, looking, okay. So I'm going to go on to the other eye, open up wide, look out straight ahead, please. Going in. Good, positive red reflex, going in. Excellent. So I was able to bilaterally see that the The disc was orange. There was, the margins were sharp and clear. There was no AV nicking. There was no lesions, and there was no hemorrhage.
What's the context?
I asked him that already. Okay, so next time we're gonna go on, we're gonna do some exercises. Here, I'm gonna be testing for cranial nerve 3, ocular motor 4, trochlear, and 5, abducens. I'm gonna have you watch my finger and just with your eyes, okay? Follow. Looking for any nystagmus. Follow with your eyes. No nystagmus noted. Now I am going to have you do the accommodation. I'm going to have you look here. I'm looking at your pupils. Look out. Look back here. Look out. Good. So I'm looking at his pupils for accommodations. They are dilated when he's looking far away, and they're constricted when he's looking close. So that indicates that 3, 4, and 6 cranial nerves are intact. Now I'm going to go ahead and I'm going to look at your sclera and your conjunctiva. So just open your eyes normal. Just going to be looking, going to pull your lid down, looking up. Look up for me. Look at the side to side. Good, and down, and the other side. Look up, side to side. Good, and down. Okay, good. So Clara was sclera was clear, white. The conjunctiva was clear. The sclera was white. All right. So next, eyes. Next, I'm going to go on to the ears. So with the ears, Kai, I'm going to have you cover one ear, and I'm going to whisper something. I'm going to have you repeat it.
Seattle.
Good. Do the other ear.
Baseball.
Good. So positive for the whisper test bilaterally. All right. So I'm going to feel your tragus, any pain, the auricle, any pain, no redness, no swelling. Good. Now I'm going to be looking in your ears. I'm going to be looking at the tympanic membrane. Okay, Kai? So now hold nice and still for me. Okay. Doing the 3-point bracing. Good. So I'm going to go on to the other side. Good. So here I was able to bilaterally see that the tympanic membrane was pearly gray. There was minimal cerumen, no redness in the ear. I was able to see the bony landmarks. All right. So next we're going to go on, to your nose. Okay. And I'm just going to look in your nose here. Good. Gonna look on the other side. Good. So I was able to see the septum in both sides. That was straight in midline, no deviation, no polyps. Mucosa was pink. There was no polyps, and then the terminates were non-boggy. Do you have any problems smelling coffee being brewed? So that indicates that olfactory cranial nerve 1 is intact. Next, I am going to go on to the cranial nerve 5, which, next we're going to go on to your mouth. So, Kai, I'm going to have you say, good. Looking at your dentition, looking at under your tongue, I see no lesions, no leukoplakia. Dental dentition is intact and good. No blocked ducts. All right, great. So now I'm going to have you stick out your tongue again, all the way out, and say Say good. So uvula is midline. The soft palate rose and falls symmetrically, which indicates that cranial nerve 10 vagus is intact. Now I want you to stick out your tongue for me. I move it side to side. Tongue is midline, and I'm out of order on this. Tongue is midline. Go ahead and you can stick it back in. Tongue is midline without deviation and full range of motion. Right, so next I am going to I'm going to palpate your lips and your tongue, feeling your lips, feeling the roof of your mouth, feeling the sides, both sides under the tongue. Now I'm going to have you stick out your tongue. I'm going to palpate your tongue. Good, so no palpable lesions or masses in the mouth. The lips, no sores or cold sores or redness, swelling. Okay, now we're going to go on to cranial nerve 5, which is the trigeminal. So here I'm going to be feeling the temporal muscle. Go ahead and clench your jaw. Good. Here, the mandibular joint. Okay, go ahead and open and close your mouth. Good, 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 good. Again and again. Good. So no crepitus could be felt. No audible clicking of the jaw. So the cranial nerve 5 intact with good strength. 5 out of 5. All right. So now I'm going to go to cranial nerve 7, which is the facial. Here I am. 7 and 9.
This is 7.
Okay. 7. Now I'm going to have you raise your eyebrows. Good. And then I'm going to go ahead and have you smile. Good. Show all your teeth when you smile. Good. Now I'm going to frown. Puff out your cheeks. Good. All right. So cranial nerve 7 is intact, the facial. Now I'm going to go on to cranial nerve 7 and 9, which is facial, and cranial nerve is glossopharyngeal. Are you able to taste, or have you had any changes in your taste recently? No, good. So those are intact. Cranial nerve 7 and 9.
7 also, you got to do the test the eyes. Facial nerve is intact. That one.
Oh,
that's 7.
Okay, go ahead and close your eyes for me. Press against me. Good. 7 intact. So the strength 5 out of 5. I also forgot to check your pupils. This is cranial nerve 2 and 3. Look straight ahead. I'm looking at good. I'm looking at consensual and direct. Intact for consensual and direct. Pupils are 4 millimeters round and equal. Let's see. So now we're going to go on to cranial nerve 11. Here, go ahead and shrug your shoulders against me. Good. So muscle strength 5 out of 5. That is the trapezius muscle, which is cranial nerve 11, the spinal accessory. Push up my cheeks. Good. 5 out of 5. Again, 5 out of 5. So there we have the sternomastoid muscle. Now, Kai, I am going to have you do some range of motion. No. I'm going to look at your trachea. Right? Or am I going to do
neck, lid, thyroid.
Oh my God. So I'm getting tired. Okay, so now we're going to do the, now we're going to check your glands. Okay, so here I am going to go ahead and feel the preauricular, postauricular, occipital. Then I'm going to go on to the tonsillar, submandibular, submental, supraclavicular, infraclavicular. Then I'm going on to the central axillary mode, which this will be on another page. Feeling up in there, good. Gonna go ahead and feel this side. Just relax your arm down for me. Good. Good. So no palpable lymph nodes greater than 1 centimeter. There's no tenderness, no firmness, no fixed nodes. All right. So now I'm going to have you I'm going to have you take a sip of water. And I'm going to be watching your throat. So take that down before you swallow. Good. Okay, go ahead and swallow. Good. So trachea is midline, rise and fall symmetrically. All righty. Now I am going to go around. We're going to check your thyroid. Shoot. Okay, so check your thyroid. Here we go, Kai. Now I'm going to place my hands around your neck. All right, go ahead and take a sip of water. Swallow. Good. All right, so here I'm feeling the lobes of the thyroid, feeling the isthmus. And each of the lobes, no nodules, no swelling noted, no goiter noted. All right, now we're going to go and we're going to do your spine.
Did you have any tenderness?
Any tenderness when I did that? No. Okay, so take a deep breath in. Good. I'm looking for chest expansion. Okay, go ahead, take a deep breath in and out. No, big deep breath in and out through your mouth. Again. Good. So looking at the rise and the fall, hands were symmetrical. Looking at the AP diameter, the AP is half the size of the lateral, which is no chest abnormalities. All right, now we're going to feel for your spine. I'm going to go down the spine, feeling for any step-offs, also feeling, let me know if there's any tenderness, Kai, also feeling for any bony abnormalities. Then I'm going to go on to the paravertebral muscles. Again, let me know if you're having any pain, feeling all the way down. Good. Any pain there, Kai? So no lumps or no spasms. All right. Okay. Now, Kai, I am going to assess your breast. Am I in the right order?
Particular posterior leg.
Yeah. Oh my God. See, I am so tired. Okay. So now, Kai, I'm going to go ahead and do your lung sounds. Deep breath in and out every time I touch you with the diaphragm on my stethoscope. Good. Again. 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 You doing okay?
Mm-hmm.
Again. Again. And again. Okay, and then I'm going to do the right middle lobe. In and out. And one more time for me. Good. So lung sounds were clear to auscultation. They were symmetrical or equal throughout. No wheezing, no rhonchi, no crackles. All right, now we're going to do the front. This time in and out through your mouth. So anterior, go ahead again. Again. Good, and one more. Anterior. Okay, so one sounds clear anteriorly. No wheezing, no crackles, no rails. All right. Okay.
You did the right middle.
Yes, right little. Yes, I did the right middle. That was clear. Okay, so now Kai, I am going to look at your breast. Go ahead and put your hands on your thighs. Kind of puff out your chest here. I'm looking for symmetry. I'm looking for any dimpling. I'm looking for any abnormalities, lumps, visible lumps, orange peel. Go ahead and lift your hands over your head again, looking for the same thing. None of those signs are indicated. Go ahead and put your hands down. Good. So Kai, now the next thing I'm going to have you do is I'm going to do your breast exam here. I'm going to have you lay down.
Auscultate heart. Did you do that? Describe the location of each valve as you auscultate aortic.
Okay. Now we're going to auscultate your heart sounds, starting second intercostal space. On the right, I am aortic. On the left, second intercostal pulmonic. Going down to 3, 4, 5. Listening for the right ventricle, going to mid-clavicular, 5th intercostal space, listening at the mitral and the left ventricle, and heart sounds were regular, no murmurs. There was normal S1, S2, no S3 or S4 splitting, and no rubs. Friction rubs. Okay, good. All right, so now we've done that. We're going to go ahead and go on to doing your breast exam. Move. All right, go ahead and lay down. So here, I'm going to have you put your right hand over your head. Okay, and so here I'm going to be using just one hand at a time. Just like that. Okay, going to be using the pads of my 3 fingers, starting in the talus fence. I'm going to be doing a circular motion, and I'm going to be doing light, medium, and deep all the way into doing a horizontal pattern going to the breast, all the way down. When I get to the nipple, I'm looking for any drainage, going all the way up to the clavicular area, making sure I'm not missing any breast tissue, going to the sternal board. Then I'm gonna go around onto the other side. And here I am going to, again, start at the tail of fence using my 3 fingers. I'm gonna be, do a circular motion, light, medium, deep, light, medium, deep, going in a horizontal fashion. Horizontal, horizontal, going to the nipple, making sure there's no drainage. Going down, going all the way down to the sternal border. Okay, so I felt no lumps, no palpable masses, no lumps. The tissue was soft. Any pain on that? So no pain. Okay, so Kai, the next thing I need to do for you.
Palpate central auxiliary nodes. You got sensing central lymph nodes for any that are hard, fixed hard, greater than 1 centimeter or.
Yeah, I did that.
You did that?
Did I do the lymph lines?
I'm not sure.
All right, well, I'll do the lymph lines after I get done with this. God damn it. All right, I need to do this earlier tomorrow because I'm too tired. I'm forgetting everything this time. All right, so now, Kai, I'm gonna go ahead and feel your carotids on each side, palpating them separately. Good. So 2 plus, 72 regular, alrighty. So now I'm going to be listening for any,
Bilaterally?
what?
2 out of 4 bilaterally?
Yeah, 2 out of 4 by,
Rhythm is regular.
okay, rhythm is regular. Okay, now I'm going to go on listening for bruits. Go ahead, listening on, good, good. No bruits noted. Now I'm going to go down, listen for murmurs. On the right.
Please hold your breath and do not speak.
Sternal border, second clavicular space. That is aortic, left, pulmonic, going down to 3, 4, 5, which is the tricuspid valve, going on to the 5th intercostal space, midclavicular, which is mitral. No murmurs noted. Now I'm going to feel for your apical impulse, 5th intercostal space, feeling for that. It's non-displaced and it's what, less than 1 inch, or what is it? Less than 1. Okay, normal size. I can't say normal. Okay, so apical impulse. Okay. Now we are going to go on to listening to your aorta, again for any bruits. Listening aorta, renal arteries, iliac arteries. Okay, no bruits noted there. Now we're going to listen for ballatones in all 4 quadrants. Lots of gurgling, normal active tones. Now, Kai, I'm going to be looking at your abdomen. Is it okay if I pull up your shirt a little bit? Looking at the abdomen, looking for any striation, looking for any audible lumps, looking for any scars. All right, so didn't see anything there. So next I'm going to percuss in the 9 regions of the abdomen. Listening for tympany or dolus. Good, tympany throughout, and then I'm going to go on to palpation. So I'm going to palpate.
Percussion is dull over the liver and secondary colon.
Okay. And I'm going to palpate 1 centimeter in circular motion in all 9 quadrants. Any pain there? Now watching your face, I'm going to have you bend your knees up when you do that to relax your abdomen. Then I'm going to go a little bit deeper, watching your face, all 9 quadrants. I'm not seeing any pain, no grimacing or no retraction away from me. All right, so now Kai, I've done your abdomen. I'm going to do your liver. I forgot to do this on Sophie. Shit. I would have totally failed if I wouldn't have done our liver. Okay, so here I'm going to be doing the hooking method. Go ahead and take a deep breath in. Good. Take 1 more. Good. No palpable liver borders, meaning no enlarged liver. Go ahead. I'm going to be palpating the spleen. Deep breath in. Good. Feeling for any no palpable spleen. Now I'm going to be going down. You can put your legs out. I'm feeling the femoral arteries, rate, rhythm, amplitude, symmetry. So 2 plus out of 4, 72 regular and symmetrical. Then I'm gonna feel for inguinal lymph nodes, no noted inguinal lymph nodes. And then I'm gonna go down your legs. I am going to be looking at symmetry. I'm looking at muscle mass. We're gonna start at the hips. Any pain there? No, so palpating the quads, going down to the patella, going all the way down the shin, looking for any bleed, pitting edema, also feeling the calf muscle for any tenderness or swelling, anything there, Kai. I'm gonna go on to the other quad, down to the patella, feeling all the way down the shin. Okay, looking for any pitting edema, feeling the calf, going all the way down the foot, any pain in the toes. Good, so legs are no, hair distribution is normal, no visible pain or lumps or bony abnormalities. All right, so now I'm gonna do the pedal dorsalis pulse, 72, regular, symmetrical, 2 plus amplitude. Now, Kai, we're gonna do some range of motion of your toes. I'm gonna go ahead and have you pull up. That is, no, all the way up. Okay, that is dorsal flexion, pointing towards me, plantar flexion. And then I'm gonna have you put your toes together, which is eversion. And then I'm gonna have you put your, or no, that's, yeah, eversion, put your heel, your soles together. Inversion, so positive, full range of motion of the ankles. All right, Kai, so now I'm gonna go ahead and have you sit up. We're gonna do your cerebellar function.
Eversion?
Yeah, eversion. All right, so I did notice that I forgot to do your lymphs, so I'm gonna go ahead and do your lymphs. So I'm gonna do pre-auricular. Yeah, I already did this. Post-auricular. Did I already do this on you? Yeah, I already did that. Okay, so now we're gonna do the cerebellar test, which is the rapid alternating motion. So I'm gonna have you do palms, back your hands, palms, back your hands, faster, faster, faster. Good. So good, nice symmetry, looking at the rhythm and the rate, very coordinated on that. Now I'm gonna go ahead and I'm gonna test your, I'm gonna test your reflexes. So the first one is going to be your bicep. Okay, nice and kind of straighten it out there for me. 2 plus. Then we're going to do the brachial radialis. Good, 2 plus on that. Going to go ahead and do the triceps. Okay, 1 plus on that. Going to go ahead and do the bicep. Just relax. Bicep here. Good, 2 plus on that. I'm going to do the brachial radialis. Good, 2 plus on that. Going to do the tricep. Good, 1 plus on that. Then we're going to do, yeah, plantar flex, plantar, kind of relax. No, don't put them out, just kind of relax. Oh, 3 plus. And then we're going to do the ankle or Achilles. 1 plus, 2 plus probably. 2 plus on that. Okay, so great.
Good reflexes.
Okay, good reflexes. So Kai, now we're gonna go ahead and have you stand up. Here I'm gonna be looking at your spine. Okay, here I'm looking for kyphosis, lordosis. I'm looking at the spine to make sure that it's concave at this cervical and the lumbar, and at the thorax it's convex, which his is. Now I'm gonna go ahead and have you bend down and touch your toes, looking for any scoliosis, none noted. Go ahead and stand back up. So no kyphosis, scoliosis, or lordosis. Gonna go ahead and flex your back, extend your back. Good. So good range of motion there. Gonna have you twist at your hips and good. Follow me. Great. Now we're gonna do on the sides. We're gonna have you run your hand down to your knee on both sides. Good. So full range of motion of the spine. So now I'm going to have you walk a little bit. I'm going to have you walk forward. Go ahead. I'm looking at the swing of your arms. I'm looking at your gait. I'm looking at your step. I'm looking for any shuffling. I'm looking for any foot drop. I'm looking for any leg lag, any wide step walking. Now go ahead and walk on your toes. Good. Come back on your heels. Good. So nice, good gait, strength there. We're going to do tandem walking like this. Good balance. Go ahead and come on back. And then here, I'm gonna have you stand. I am gonna have you lift one leg up and then have you go down a little bit, looking for the strength of your leg muscle. Good, let's do the other leg one more time. Good, nice, full, good strength of your leg. Okay, Kai, you are done. So now I'm gonna go on to the 29?
Yeah, I didn't, it hasn't stopped. And you're at
Did I miss a bunch of shit?
genitatorial exam, no?
That can't be right. Okay, so now we're gonna go on to the, is this not even going? Okay, so now we're gonna go on, okay, Kai, you're all done, buddy. Now we're gonna go ahead and go on to the genital urinary of the male and the female. So first we're gonna do the male. The male, I'm gonna wash my hands, I'm gonna glove up, I'm gonna have him stand, I'm gonna be seated. Initially, I'm gonna be looking at his perineum, I'm looking at hair distribution, I'm looking for any infestation, I'm looking for any rashes, lesions. I'm gonna be looking at the skin, inspecting his penis. I'm going to palpate down the shaft of the penis to the glands there. If he is not circumcised, I'm gonna have him retract it. And then I'm going to be looking at the urethral meatus. It's looking for lesions, looking for any drainage. Okay, then I'm going to go on to the testes. With the testes, I am going to go ahead and feel them one at a time, feeling for any lumps, any tenderness, any pain that he might be having. Going to also feel the epididymis. Feeling it, feeling for any nodules, going and finding the spermatic cord, following it up to the inguinal ring, sticking my finger into the inguinal, my index finger into the inguinal ring. I'm going to have him turn his head and cough. Here I'm feeling for any bulges. There's a bulge, then that would indicate hernia. I'm going to go ahead to the other side, do the testicle, palpating the testicle for any lumps or nodules, going up to the epididymis, feeling it, going up to the spermatic cord, following the spermatic cord up to the inguinal ring, inserting my index finger in, having him turn his head and cough, feeling for any bulges. Now we're going to go on to the rectal exam of the man. I'm going to stand, I'm going to have him bend over the table. I'm going to have him bear down. I'm going to be looking at the anus, looking for any hemorrhoids or fissures. I'm going to lubricate my index finger. I'm going to tell him that I'm going to be inserting my finger into his rectum. And of course, this is if he has agreed to have this done. I'm going to have him bear down, insert my finger into his rectum. I am going to rotate it, feeling the posterior, anterior, and both lateral walls, feeling for lumps, indurations. Then I'm feeling also for sphincter tone. Then I'm going to go to the anterior, feel for the prostate, feeling the sulcus and the two lobes, feeling for any lumps. It should be protruding about 1 centimeter into no more than that. It should feel like the eraser on a pencil, and it should be non-painful. Then I'm going to remove my finger, give him a tissue. Then I'm going to go on to the female exam. The female, I'm going to place her in the lithotomy position, wash my hands, put on my gloves. I'm going to drape her so that I can see her face. Okay, I'm going to be looking at the mons pubis, looking at the hair distribution, looking for any lesions, infestations, looking for any rashes. Then I'm going to go look at the labia minor, labia major, looking at the clitoris, the urethra, the interosseous, and the rectum. Again, inspecting for any lumps, lesions, warts, those types of things, hemorrhoids in the rectum area. After that, I'm going to take my speculum that I have been soaking in warm water. I'm going to put a small amount of lubrication on it. I am going to, before I touch the patient, let her know what I'm doing. I'm going to place my left index finger at the posterior wall of the vagina, putting a little pressure on it. I'm going to insert the speculum at a 45-degree angle. And once it's all the way into the vagina, I'm going to turn it to horizontal position. I'm going to slightly open it to see if I can visualize the cervix. If I cannot, I'm going to pull it out, slightly close it, and reposition it upward. Open it again, then I visualize the cervix and the os and the vagina. Here I'm looking for any lesions, bleeding, redness, anything, any indurations. Once that is done, I am going to go ahead and start pulling the speculum out just slightly past the cervical os. I'm going to close the speculum. With a downward motion, I am going to pull, with downward pressure, I'm going to pull it out. Then I am going to remove my left glove. I'm going to let the patient know that I'm going to be doing the bimanual exam. With this, I'm going to lubricate my index and my middle finger. I am going to insert my index and middle finger into the vagina, feeling the cervix for any tenderness, touching the patient's face, see if she has any tenderness. I'm going to be palpating the walls of the vagina, feeling for any lumps or masses. After that, I am going to go ahead and take my non-dominant hand, the one, the ungloved hand. I'm going to press on the upper part of the uterus, pressing downwards to feel the size of the uterus, as well as if it's fixed or firm, or if she's having any tenderness. Okay. Then after that, I'm going to rotate my fingers towards the right, and with my ungloved hand, I'm going to be swooping down, trying to capture the ovary, which should be the size of an almond. It should be non-tender. It should be palpable, movable, and there should be no masses. And I'm looking for all those things. Then I'm going to go ahead and rotate my hand to the left, pointing my fingers upwards, and with the sweeping motion, again, using my non-dominant hand, trying to capture the ovary, size of an almond, non-tender. She might feel a twinge of pain when I capture it, and then a feeling for lumps, feeling if it's fixed or any nodules. And that's the end of my exam.
35 minutes.